Choosing the best health insurance for your baby can feel overwhelming: premiums, coverage, networks. It's a lot to take in, especially when you're already adjusting to life with a newborn. But don't worry, we're here to simplify it for you. Welcome back to Newborn Care Guide, where we help new parents navigate the early stages of raising a happy, healthy baby. In today's episode, we're answering a big question: what is the best health insurance for babies in the USA? We'll break down your top options, what to look for, and how to make the smartest choice for your family, whether you're insured, uninsured, or somewhere in between. Let's start with the basics. 1. Why your baby needs health insurance immediately from the moment your baby is born. They're eligible for health coverage. And that's critical. Babies need regular pediatric visits, vaccines, and sometimes unexpected emergency care, all of which can get expensive without proper coverage. You typically have a 30 to 60 day window after birth to add your baby to a health insurance plan, so timing matters. 2. If you're covered through an employer plan, if you or your partner have insurance through work, this is usually the easiest path. Most employer-sponsored plans allow you to add your newborn as a dependent within a specific time frame, usually 30 days after birth. These plans often offer comprehensive coverage, but be sure to review pediatrician availability and network coverage for immunizations and baby visit. Emergency room coverage, deductibles, and out-of-pocket max. Employer plans tend to be cost-effective, especially if the employer subsidizes part of the premium. But don't assume it's worth comparing. 3. ACA Marketplace plan. If you don't have employer coverage, the Health Insurance Marketplace under the Affordable Care Act is your next best option. You can apply for a plan through healthcare.gov or your state's exchange, and adding a newborn qualifies you for a special enrollment period. Marketplace plans come in tiers: bronze, silver, gold, and platinum. Silver plans are a good middle ground for most families, especially if you qualify for subsidies based on income. Bonus: all ACA plans must cover essential pediatric services, including immunizations, developmental screenings, and routine doctor visits, without charging a copay or deductible. 4. Medicaid and CHIP. Here's something many parents don't realize: your baby might qualify for Medicaid or the Children's Health Insurance Program, CHIP, even if you don't. Each state runs its own Medicaid and CHIP program with different income limits and rules, but generally speaking, these programs are incredibly affordable, often free or very low cost. They cover everything your baby needs: checkups, hospital visits, vision, hearing, dental, and more. And yes, babies born in the US are eligible, regardless of the parent's immigration status. Even better? Many hospitals help you apply before you leave the maternity ward. So if finances are tight, don't hesitate, this coverage is there for your baby. 5. TRICARE, VA, and other federal programs. If you're an active duty military member, veteran, or government employee, you may be eligible for plans like TRICARE or Federal Employee Health Benefits, FEB. These programs offer strong pediatric coverage at low costs and are often overlooked when discussing newborn insurance options. 6. Private insurance or short-term plans. Private, off-exchange plans are available, but they tend to be more expensive and don't always include the same protections you get from ACA-compliant plans. Short-term plans are also an option, but be cautious, they often exclude pre-existing conditions and preventive care, which makes them a poor fit for babies. 7. What to look for when choosing a plan. Whichever path you take, here's a checklist of what to focus on. In-network pediatricians and hospitals near you, free baby visits and vaccination, emergency coverage, affordable premiums, and a reasonable deductible coverage for specialists like allergists or developmental therapists if needed, prescription drug coverage. Also, don't forget to check customer reviews of the plan or insurer. Some companies are easier to deal with than others when it comes to claims and billing. So, what's the best health insurance for babies in the USA? The answer really depends on your situation. If you've got employer coverage, start there. If not, look into marketplace options, Medicaid, or CHIP. The best plan is the one that offers solid coverage without draining your budget. If this video helped you feel more confident about choosing baby health insurance, give it a thumbs up and share it with other new parents. And if you still have questions about specific plans or state-by-state programs, drop a comment, we're here to help. Thanks for watching Newborn Care Guide. We're here to make your parenting journey a little smoother, one video at a time. Don't forget to subscribe and hit the bell so you never miss a new episode. Until next time, take care of yourself and that beautiful baby of yours.